begin your statement.
Thank you. Good morning, Chairman Benesek, Ranking Member Brownlee, and members of the committee. I am privileged to be here today and to speak on behalf of the American Legion, our National Commander Dale Barnett, and more than 2 million members in over 14,000 posts across the country that make up the backbone of the nation's largest wartime veteran service organization. There are several good bills for discussion today. And your full remarks are with you. I would like to focus on one key bill. H.R. 1603, Military Sexual Assault Victim Empowerment Act, or the Military Saved Act. This bill would enable the Veterans Access, Choice, and Accountability Act of 2014, which is to improve the private treatment of veterans who are victims of military sexual trauma. This bill would make victims of military sexual trauma potentially eligible for non-VA health care under the Veterans Choice Program. Ultimately, this is about trying to find the right treatments and therapies for every veteran. And in the case of MST, unique circumstances can shape treatment and therapy needs. VA should be flexible to ensure these veterans receive the appropriate care they need in an environment that is conducive to the veteran's unique circumstances. MST, if left untreated for veterans, is a nexus to other mental health conditions such as PTSD, depression, substance abuse, and suicidal ideations. In the case of these survivors, ensuring they get the appropriate time and therapy can mean the difference between a survivor continuing their treatment, abandoning treatment, and feeling further isolated and possibly escalations in their symptoms. The American Legion is deeply concerned with the challenges survivors of MST face and is urging Congress to ensure MST survivors can receive the right health care at the right place and at the right time. In January of 2011, the American Legion launched a landmark Women Veterans Survey, which identified challenges women veterans face when receiving gender-specific health care for treatment of MST conditions throughout the VA healthcare facilities. The American Legion has since fought for better awareness training in the VA for MST sensitivity, significant increases in outreach, and to provide more comprehensive care options for MST survivors to include female therapists, group therapists, and other options for care for MST accessibility to include care in their community. As noted in our written testimony, VA is working to improve their MST programs. However, as we know, changes within the VA can take time, and even the best programs can have different results from one VA to another. The veterans should not have to suffer because the health care they need is not available in their local health care facility. The American Legion recognizes that the Choice Program was an emergency measure to make health care accessible to veterans where VA was struggling to deliver such care. In recognition of the needs of an integrated system to deliver non-VA health care when needed, the American Legion believes VA needs to develop a well-defined and consistent non-VA coordinated program, policies, procedures that include a patient-centered care strategy which takes veterans' unique medical injuries and illnesses, as well as their travel and distance into consideration. For survivors of MST who are suffering right now, the American Legion believes they should have immediate access to prompt medical treatment, either within the VA healthcare system or in their local community. As with an outside VA, the American Legion stresses the importance of ensuring non-VA healthcare has quality of care standards equal to or better than VA quality care standards. Additionally, the care MST survivors receive must be coordinated effectively and efficiently to ensure veteran health care is not adversely impacted. Most importantly, non-VA healthcare providers must have access to VA healthcare records and to the full extent possible make use of the electronic data information exchange to ensure patient health information. Again, I thank you. I thank the committee for their hard work and consideration for this legislation, as well as your dedication to finding solutions for problems that stand in the way of delivery of veterans' health care. And I'm happy to answer any questions.
Thank you, Ms. Holt.